everybody, it's Beth and Rachel here. Rachel is our PT. She's going to be working us through our strengthening workout for this month. I am Beth. I'm going to be your modifier. So if you have difficulties getting out of a chair or you need more modification, you're going to be looking towards me. All right, Rachel, let's go ahead and get started.
All right, the first exercise is a three-part exercise. Beth and I are going to alternate, showing you the standing variation as well as the modified. So the first is a squat. So you're going to sit back, push the butt back, and come back up. Bend those knees. The further down you go, the harder it'll be. And Beth, for the modified.
All right, so if you're modifying in a chair, what we're going to do today is you're going to just march. Bring that knee up so you're sitting at the edge of your seat. Really squeeze the belly and pull that knee up. If you want to bring your arms out to give yourself a little guide of where you're bringing that knee up to. But nice and slow, never fast. When we're strengthening, it's always time under tension. So how long can you hold that under muscle tension?
All right, next part of this exercise, we're going to add a side step. So you're going to squat, side step, come back to the middle, squat, side step, come back to the middle.
All right, great job. For the modification for this one, and I know your legs are getting tired, so we march up, and when you march up, you're going to arch it out to the side for a side step and bring it back. So no sliding like this. What I want to see is lift, open, tap, and bring it back. Lift, open, tap, and bring it back. Great job. Let's do 3 more of these on each side. 1 and 2. Try to keep your body nice and stable. As you're sitting at the edge of your seat, the upper body should be nice and stable. Pull that core in tight and just move that lower extremity right out of that hip joint. All right, I think we're moving on to the next one.
Okay, so now what we're going to do is we're going to squat. Stay down in that squat. Side step, side step, side step, side step. Come back up.
All right, so how I'm going to modify is I'm going to sit here. Now, if you have a band that you can wrap, like an elastic band you can wrap around your knees, this would be a great time to do it. But what I'm going to do is just open and close my knees. You can put your hands on your knees and use resistance of your hands to open against resistance, or again, you can tie that elastic band around your thighs and work on these hip and glute muscles. So if you look at Rachel, she stays down when she's side walking. You do not want to stand up nice and tall. When you're down in that squat position, you want to engage those glutes. You want to make sure those glutes are working the whole time. All right, let's do 5 more. I'm sure Rachel's thrilled that we're going to do 5 more. This is 3 and 4. And remember, you can always do this exercise 2 times through. If you'd like to get a second or third round to make this video a little more than 15 minutes, maybe you want to do it 2 or 3 times to make it a half hour, 45-minute workout. All right, and we're moving on.
Okay, next exercise, 2-part exercise. We are going to start with the weight shift. Spread those legs shoulder width apart, lean to one side, pick the heel up on the other side, and you're going to go back and forth.
So if you're modifying in a chair, what you're going to do is you're going to lean to one side and reach. You're going to lean to the other side and reach. Now, if you can notice, Rachel's heels are coming off the ground, just that toe tap. And for me, you're going to notice that I'm coming up off the chair a little bit on that glute. So as I reach as far as I can, my glute comes up off the chair, and we're weight shifting side to side.
You can also add in that arm component, just like the seated version. Helps you weight shift a little bit further. Gets a little bit of overhead movement in the standing position. We'll try a couple more. Okay, second component of this exercise. Similar to the weight shifting, but now we're gonna weight shift, add a lateral lunge, weight shift, add a lunge, do a couple on both sides, weight shift, add a lunge, weight shift, add a lunge. So what you'll do for that lunge is do a little bit of step to the side, bend that knee, come back to the middle.
All right, for modification purposes, what we're gonna do is we're gonna reach, and you're gonna step and lunge forward and bring it back. Reach, step, lunge forward and bring it back. Reach, lunge forward. Now, if you look at Rachel's knee, her knee is never crossing her toes. So when you go into your lunge, you never want your toes to go beyond, your knees to go beyond your toes. All right, that's looking good. Let's do 2 more on each side. And again, if you wanted a little more out of these videos, feel free to play them twice. Get 2 rounds out of each video. All right, try 2 more on this side.
All right, so next exercise, another 2-component exercise. So what you're gonna do, we're gonna call it football arms. If you've ever seen a touchdown on TV, it's a similar fashion. So you're gonna reach up overhead, pull the elbows down, squeeze those shoulder blades, come back to the middle, come back out, and squeeze down, and then come back down. Up overhead, down in that football position, squeeze those shoulder blades, into the middle, back out, squeeze again, come back down. You can go very slow for this exercise, worry more about the actual active movement rather than going fast.
Now, if you have some light dumbbells and you'd like to use some light dumbbells, you're welcome to do that. I wouldn't go super heavy here. I don't think it's necessary, as long as you're really focusing on squeezing those shoulder blades together as you open. I don't think dumbbells are really that necessary, but you should feel a nice burn in between your shoulder blades as you open and release. And again, you don't want to go through these really quickly. We're not here, anytime we do strengthening exercises, they're always going to be nice and controlled, nice and slow. Really work on form, work on squeezing that muscle. Let's do 3 more full rotations here. There's 1. And 2, 1 more, nice deep breath in, fill those lungs, exhale, squeeze, inhale, exhale, squeeze, and release.
All right, next part of this exercise, now that you know how to do the football arm component, you're gonna start, come up with your arms, get back into that football arms motion. You're gonna put your arms out to the side, extend those elbows, come back up and relax. Here, out to the side, curl up and relax. To make this a little bit more challenging, what you can do is you can continue holding your arms up to the side. This is an isometric exercise for your shoulders, which means that it's kind of a 2-for exercise. Shoulder strengthening as well as some bicep strengthening.
And it's really important as your arms are open that you squeeze those, don't come forward like this. Sit up nice and tall, squeeze those shoulder blades behind you, and curl and release. Curl and release.
As you can see, I needed a little bit of a rest. So I just brought the arms down to the side, went back through the motion, got myself back into position. You can take as many rest breaks as you need to.
All right, great job. Let's do 5 more. 1, 2, Shoulders down, don't let those shoulders creep up. And release them down. Oh, shake out those shoulders. You should feel all of those postural muscles all the way down your back on fire right now. All right, so we're moving on to the next exercise. I'm gonna modify in a chair, and then we're gonna show a clip of Rachel doing this exercise against a wall.
All right, as promised, here's that wall push-up here. So what you're gonna do, get your feet back, your butt down. What you're gonna do is you're gonna push down, hold for 3 seconds, and come back off, okay? Come down, hold for 3 seconds, come back off.
So if you are sitting in a chair, what I'm gonna have you do is I'm gonna have you reach forward and push your shoulders forward, reach as far as you can, and then you're going to bring those elbows back and open up that chest and squeeze and hold for 3 to 5 seconds each, all right? So we don't want this to be very quick. So push forward and squeeze. Sitting up nice and tall, maybe you gaze up towards the ceiling, chest is nice and open. Push and open. We're gonna do 3 more here. And 2, really push forward. You should feel a nice stretch between your shoulder blades. And squeeze. And last one, push forward and squeeze. And relax down. Shake it out. Again, I hope you enjoyed your strengthening workout today. This is Beth. Hi everybody, it is Beth and Rachel from Wellness 360. We are going to work on balance today. All right, so grab a chair for support or to sit in like me. Rachel, our PT of the hour, she's going to be the one that's teaching the exercise. And I am going to be your modifier. So if you need any form of modifications, come to me.
All right, first exercise we're going to start with, it's called hip abduction. It's going to be kicking to the side. So pick one leg to start on. You're going to kick out and back in, out and back in. Beth with the modification.
All right, so with the modification, I actually have this lovely little band here. All right, so what I'm going to do is I'm going to stick this band not as easily as it looks. It's not easy to get on, so you don't have to use a band. It just adds a little more resistance. So I have the band around my thighs, never my knees, and I'm going to open and close. If you don't have a band, they're super cheap. You can get them from Walmart or Amazon. They're less than $10, or you can just use your hands and open against the resistance of your hands.
So as you can see, I switched sides. I did about 10 on the right side. Now I'm doing 10 on my left side or your right side. A way you can modify a standing variation, I have a chair next to me. You can always hold onto the chair, kick straight out and back down. What I need you to remember is this direction of your hip does not have a lot of range of motion. So if you feel like you're starting to do this, you're going way too far. If you can see, mine's coming off probably up to 10, 12 inches. I'm going to switch to the other side. Same thing here.
So I like to call these notebook moments. I'm a big journaler as far as working out. This is a great moment to take and see how many times you can kick out to the side without tapping down between. So maybe you do 2 or 3, maybe you do 4 or 5, but without tapping down in between. And then always notice, do I have a strong grip on that chair? Is it fingertip grip? Is it one finger? Is it no hands? Are you just hovering the chair? And this is how you're going to measure your progress. If you're in a chair, maybe it's how many can I do? What color is the resistance band? And these are really great ways for you to show that these videos are working, that you are becoming more stable, and that your fall risk is decreasing.
All right, we'll try a couple more. Another way to kind of progress this exercise is the band that Beth has on her modified version. You can also add that to a standing version. You can start it with above the knees. As you move the band down, the harder it will be. I do recommend having a chair to start with that. Safety first, as always.
Yeah, it's one thing to lose your balance. It's a whole other thing to lose your balance when your legs are tied together. So please use caution, but it is a wonderful exercise.
All right.
If you're using the band, always be in a seated position when taking it on and off. That's very important.
That's a good tip. Okay, next we're going to do, it's called clock taps. So we have these fun dots here. You can use tape, paper plates, kind of anything on the ground just to give you something to reach towards. I'm going to put these down on the ground. Beth has already done so for herself here. Okay, so what you're going to do is start right in the middle. You're going to take your right leg, tap the dot, come back out, go to the side, come back out, go back. As you can see, I'm doing some weight shifting here. So you do want to kind of offload the standing leg and put your weight onto the moving leg. You can see I put my hands up just to kind of keep my balance. And then Beth will explain the modified version.
So for the modified version, I have some dots right in front of me and some dots out to the side. Now you don't have to go out and purchase dots. You can use some construction paper or Post-it notes or whatever you have. Maybe you notice a fuzz that's on your carpet, but just have something to aim towards. So you can do a couple on one side. I tap forward and then out to the side, and then the other side forward and out to the side, and just alternate between the two. You can do 2 on each side, 1 on each side, or stick all to one side and then all to the other side.
A way to modify the standing version. I still have my chair here. I'm going to move it in front of me. Okay, so what you can do light with your hands. You can do this at your counter, just anything that's more stable. Same thing. Tap each, try and weight shift. Okay, switch sides. Another way to make this more challenging. So what you can do, I'm going to take this chair away, and you can actually spread the dots out. This will make you have to reach a little bit further. Again, make sure you have somebody nearby if this is a new activity for you. We will promote safety till our face is blue. Always safety first.
Especially when you're doing exercises at home. There's so many things you can do at home that are so good for you, but there is a safety concern when you don't have one of us looking at your form. Remember, you can always email us and contact us. If you're local, we definitely do home visits, so we can come to your home and we can go through these exercises with you. Or you can just shoot us an email and ask questions accordingly.
All right, let's try one time through. I'm going to finish up on my left, your right. Okay, we are done with the dots for now. I'm going to pick mine up.
I'm going to keep mine 2 down to the side for our next exercise.
Okay, last one. This is the most challenging. It's going to be single imbalance, which is standing on one leg. Get comfortable with that. I do have my chair here. And you're going to add in head turns. Stay on one leg, head to the left, head to the right. Nice and slow. And I'll continue as Beth explains the modified version.
All right, so as we're doing our head turns, I'm actually going to be stepping to the right and turning my head to the right, nice and slow. Remember that these head turns can stimulate vertigo. So I'm going to let Rachel talk a little bit about vertigo. But as you're doing this, it's really important that you go nice and slow so you don't stimulate any kind of dizziness. So I'm stepping to the right, I'm turning to the right, hold for just a moment, and bringing everything back to center. I'm stepping to the left, I'm turning my head to the left, and bringing it back to center. So Rachel is actually a specialist in vertigo, so that's good to know. So I'm going to let her talk for just a second about head turns and vertigo.
So switch legs first and keep doing some of the head turning. I'll explain. Vertigo is an inner ear disorder. As physical therapists, what we can do is evaluate you, and we can also treat you in various different ways. With the head turning, with the inner ear, you're kind of throwing it off balance a little bit. So if you are experiencing some vertigo symptoms, we would prefer you to stop that for now. And if it's something that is easily triggered, feel free to contact us. I would be happy to evaluate and assist you in any way possible. Stick with the single imbalance, and we can kind of go from there.
Great job. We have just a couple more of these. Now, Rachel, I'm going to have you run through some modifications. If a single leg balance does not work for you, there's different ways you can start by placing your feet nice and close together. And I'm going to let Rachel kind of go through those steps. So single leg, if you were like, this is just not working, here's some different ways that you can modify that single leg balance.
So first is a narrow base of support or your feet close together, okay? You'll do it exactly the same way. Have a chair nearby if you need it, and do some of those slow turns. If you feel that this is too easy, you can go in what's called a semi-tandem stance, which is your feet they're still next to each other, but they're shifted, one shifted a little bit back. This is semi-tandem. Again, try with the head turns nice and slow. The next variation is a full tandem stance. So one foot right in front of the other, like you're walking on a tightrope. Again, keep that chair nearby. Do some of those slow head turns.
Now remember, with the ataxia pattern, it is really hard to have a narrow base of stance. We know that. So it's really important you maintain your safety, and we are purposely putting you in these positions to challenge you. If these are too challenging, you can always increase your base of stance. So widen your base of stance and try with just the head turns. Don't ever feel like you have to do it because that's what Beth and Rachel said. No, the wider your base, the less challenging the exercise is. So we want you to be challenged. Please check out our perceived rate of stability chart on our website so you can see the best zone for you to be in when you're doing these balance exercises. All right, let's do one more on each side, nice and slow. And last one. And we are all finished your balance challenge for today. Enjoy your day. Again, this is Beth and Rachel with Wellness 360.
Thank you.